part of their story as it relates to this theme. The title for today is Crafting Organizational Life to Have a Positive Impact on Employee Mental Health. And each of the people that I've invited are people that I have either experienced very closely with Edita as a colleague, or have seen at a distance, with Jim being the furthest away in America, and how the way they lead has had a positive impact on employee mental health. Linda, welcome as well. I'll go ahead and introduce each of the guest speakers, and they'll have the chance to tell you a little bit about themselves. And then after we hear from each of them, we'll split up into breakout rooms, and you'll have the chance to interact, to share your thoughts on these questions. This is one of the parts of these sessions that people have appreciated, the chance to share their ideas and to hear from others, to test out some of the things that they're thinking. And then we'll come back together and wrap it up with each group sharing a little bit of what they've learned in the group. So Linda, we'll go ahead and begin with you. Linda is the founder and owner of EasyPay Albania. And Linda, could you introduce yourself and tell some of your experience leading an organization this year, what you've observed about leading and about the wellness of your employees?
Hi, everyone. Thank you for inviting me in this workshop. I'm pretty happy to share with you the experience of EasyPay regarding this very important issue like mental health, which is rarely discussed in our country by culture. So it's not in our culture that we discuss about the problems with mental health. So thanks, Josh, and your team for bringing up these kind of discussions. I will gladly share some of the practices and the challenges we passed through the last year, but maybe I would prefer mainly to listen in the beginning, Jim, what he could tell us more from other countries, from other cultures, from his experience, and then I can share with you 2-3 examples and best experience we had regarding this issue. But I can continue if you want, no problem.
Yes, Linda, feel free to continue if you'd like to, or if you'd rather, we can hand it to Jim and then come back to you.
I would prefer to start with Jim, but yep. Otherwise I can continue, no problem.
Great, okay, thank you for your kindness in letting Jim go. So Jim, I remember the first time meeting you. Jim is the president of Clarkson College in Nebraska, for those of you that are just meeting him. He was in Albania about a year ago, just before the pandemic started. And I remember the first time meeting you, Jim, that you mentioned the power of asking the question, I think it was, how can I make your day better? And you have a background in nursing. Now you're the president of a university. So could you tell us a little more about that question and how you've seen that impact the wellness of people that you've been around?
Yeah, thank you, Josh. It's a real blessing to be here with everybody today. And I wish I spoke even broken Albanian so I could, relate and connect with you. So I, appreciate your graciousness in interpreting. You all have much better English skills than I do Albanian speaking. So if there's anything that doesn't translate well or that I can clarify, please please ask. So Josh, I remember that interaction that we had as well when we first met each other. And maybe to your question, what I wake up every day asking myself is, who can I serve today? Who can I impact positively? I just ask and pray for one person that I can help that day. Now, sometimes that means doing something. Sometimes it means not doing something, right? Being patient, being still. So I have made this a habit for 20 years, and I've never been disappointed. I've always found every single day a way that I can help somebody, whether it's something I say, whether it's something I do, whether it's just being present, maybe not asking questions, right? So that's an interesting dynamic too, is that you wake up asking a question of how can you serve and be of help to somebody. And what you end up finding at the end of the day is that I remained still and just listened. And that's hard for me to do sometimes, is just to listen, right? Because I feel like I have to be doing something. I'm a nurse, right? I've been a nurse for almost 25 years. And I went into the healthcare field to want to help people and help make them better. You know, physical health, mental health, spiritual health, whatever dimensions that takes, right? So it's my nature to want to help, and sometimes I talk myself into believing that that means I have to do something, and sometimes that's not necessarily always the best thing. So I think one of the examples that I gave maybe in that first meeting, and I have literally hundreds, I think I could search the data bank here and share, but one of the ones I recall us talking about was that I don't work clinically anymore. I've been in higher education as a faculty and as an administrator the last almost 15 years. But when I was working clinically, you know, I think I recall the example that we talked about was going into a hospital. So I was in what's called the float pool. I was part of a nursing department that staffed understaffed departments in the hospital. So if they were 2 or 3 people short on a particular unit, I would be that pool of resources of people that would go in and help augment their staffing to make it full. So, which I liked. It was, again, really complemented my personality well, because I always liked helping. And in these particular instances, there were units in the hospital that really needed the help because people were sick. Life circumstances might have prevented them from working that day. So I was perceived as that person or group of people that would come in and help to right size or align their staffing for that day. So I was sitting in report in back then. I think they do it differently now. This is probably 20 years ago, so forgive the example, but I think it's still relevant today in a lot of ways. That this kind of in report, we were talking about, you know, the care needs of that patient and family, and there was some discussion about the difficulties that this patient was having. They were very frustrated, they were angry, and everybody's kind of looking around at each other like, okay, you don't want that patient, right? Because you're going to have a long, hard day if you take that patient. And I kind of raised my hand, I was still new, and I said, you know, I'll take that one, because right, I thought I was hopeful I could help. So I went in with kind of that spirit of eyes wide open, or the spirit of compassion, maybe, to try to figure out what, right? And that's what I wake up every day exploring, ways that I can help people. So I, you know, thought, hey, I'll give it a try. So I went in and I, you know, at the time I was using a clipboard, right? We would write down our notes and then typically I would be asking a lot of questions when I came in the room, maybe a stereotypical example. So what I did intentionally is I set my clipboard down and I sat down at the level of the patient who was still in the bed, and there was family there. And I sat across from them, kind of leaned in intentionally, and I said, you know, how can I make your day better today? That's the first thing I said. And the patient and family kind of looked at me like, wait a minute, you know, something's different about the way that you're approaching me. And so they kind of, the patient in particular, who I think was in pain, they were frustrated, shared with me that here, this is going wrong, this is going wrong, I haven't had pain medicines. And so then I said, well, what could I do to make that better? And she goes, well, you could start by changing the light bulb that's broken or that's not working. And I said, okay, let me start there. I'll be right back. And so I went down to the central supply where they have all the equipment. And you know, I'm not supposed to change light bulbs in a hospital, right? That's against policy. I could get hurt. I could break the light bulb. I could cut myself. It would be a workplace injury incident, you know. So I asked a favor of the central supply tech. I said, hey, I just need a light bulb. He goes, well, I can't really give you a light bulb. You're not supposed to have them. And this might sound silly, this example, but I said, no, I really need a light bulb. You know, I'll buy you a cup of coffee. What? So he gave me the light bulb. And so I went in and I changed the light bulb. And I tell you, you would have thought that I cured whatever was hurting them just by changing a light bulb. That made the whole rest of the day so much better for her and her family. And so, sorry for the long introduction, but that's the story, that kind of one example of many, many, that when I wake up, hopefully with a sense of humility and desire to serve and explore what other people need as the basis for me organizing my day, it opens up a world of possibilities that is so, I look for it now, right? I was waiting for it to happen, and now I look for it. It's because it's a behavior, it's ingrained. And it's like, well, when Josh asked me, would you like to do this? I said, no questions asked. Absolutely, whatever you need me to do. Yeah. And one example, maybe more recent. So very privileged. I feel privileged to be here among great company. I'm really excited to share stories and to be a part of this group, however I can help. So thanks, yeah, Josh, and look forward to the rest of the session together.
Thank you, Jim. Powerful example, and I'm inspired to ask that question, what can I do to make your day better, to more people today? So thank you, Jim, for being here. Linda, we'll come back to you. So you are a business owner, a leader here at a company in Albania, and tell us a little bit about what you've observed in terms of employee wellness this past year.
Thank you, Josh. As many of you might know, I'm leading EasyPay from 10 years already. And I might say that the last year has been one of the most challenging times, not only in the private life, but as well leading the organization. But anyway, we got some good lessons, which we need to carry on in the future. One of the good lessons we got is that we are much more vulnerable than we thought we should be. And especially the 2020 COVID time showed us that. But at the same time, we are much more resilient that we thought we were, because the speed we changed things and we reacted and we did the business and the organization could go on still successfully, showed us that we are much more resilient. Technology as well showed us that the connectivity has never been before like this, and has never helped people the way it is helping right now. Coming back to EasyPay and to our small organization, that we are 42 people all together, all young people with talented ones. I would like to share our experience in the beginning of the pandemic, starting from March 2020, especially during the 2 months of lockdown, and then in the middle of the year. So when the lockdown started, as many other organizations, we had to start working from home online within 24 hours. So we are a financial organization. We deal with mobile payments and money transfers. So coming back from technology background, it helped us a lot, for sure, because we have invested a lot in technology. And this way, but we never thought that we could do that within 24 hours. So, but I've seen the motivation of people. Together, they were afraid, but also very willing to do something, not to stop. And everything was organized within 24 hours. So we started immediately working online from home, all of us. And none of the operational areas stopped. We were lucky because we were in the right business at the right time, because being locked down at home, everyone wanted to buy online and pay online. So we had, from business point of view, and then coming back to the people and to the staff. So we had an increase of the work that was never seen before. So the number of transactions from the online customers tripled, more than tripled. So we had to carry on with the customer support, with IT base, with training the people, because all these people that were used to pay in cash, now they had to get trained to pay online. So it was not an easy. But how to keep the staff motivated and to work from home with no working hours, this was as well a challenge for us. But we did it, and we did it quite well. So the business has been rapidly growing. And I remember those challenging and beautiful times that we were, so there was no, as I mentioned, there were no working hours. So we have been working all together until late evening, and people doing whatever task it was possible. So because we had even some change in the business model, people that were previously focused in dealing with agent network and with cash transfer, etc., now they had all to switch to mobile and online business, and so doing multiple tasks at the same time. But I have to mention that till that time we didn't have any health problem. We were only afraid of the virus. But in the middle of the year, so starting from July on, when everything was opened and people came back to normal, the health problems started. So we faced one of the biggest problems with IT head of EasyPay, which is as well head of business development. So one of the most important person in the company, and his brother was very sick with COVID, even though he was young, 35 years old, something like that. but he was a severe case, and for that reason, Ardit, so our colleague, had to stay 2 months away from the office. But as I mentioned, he was number 2 in the company, covering very important areas. We missed his role in the company quite a lot, so we had to think about how to back up him, but as well taking care of him. So I remember those virtual coffees during late evening, so staying with him, talking to him, and sometimes remember meeting him in the lake. So just to meet and not talk about COVID at all, and try to um, mm, show him love and trust, which is the most important thing for the people in that period. So it was a difficult, very difficult time for him. He had also a little baby, a boy 2 months old. So for more than 1 month, he couldn't see the baby. So difficult times. But I remember these difficult times keep the people more closely together. Fortunately, everything passed, so he came back. But for us, was very difficult in keeping the organization and business going. Meantime, taking care of people, and without touching any of the benefits that these people profit from the company. And this is as well an important role of because everyone who is leading a business knows that there are a lot of costs associated with this crisis. But whatever the costs are, whatever the challenges are, you first of all you need to take care of the people. So it has been. I've heard once in an expression that said that customers are the first, and now they say the staff is the first, because if you take care of the staff will take care of the customers. We had another example of problems with mental health and problems with staff. And this time was maybe from October, November, with our HR manager. She was as well very sick with COVID, considered almost severe case. But at the same time, her family was all sick, and so she had to stay as well, maybe 2 months at home. We were not prepared. So always it's supposed to be a B plan, but we were not prepared at this challenging time, and with a lot of problems with HR and missing people in the office. We had to substitute somehow our HR manager. So I mostly had to take her position quite often during the day in order not to miss something from the organization, but as well keeping her calm, that whatever you are passing through, nothing will happen to your job, and nothing will happen to you. So we will be covering you completely, and welcome to the office. So these are the most difficult examples. Unfortunately, but last 2 weeks, one of our colleagues lost a family member, and this has been as well difficult for us, because his mother was living in Italy, and still today she is already dead, but still today his mother is not yet in Tirana. So very difficult time. But I've seen people taking care. So my staff is going every day and staying with him after the working hours in order to offer him love and trust and feel better. Apart from these difficult moments, what I remember from this year was as well some beautiful moments which we created with a little plannings, because you can't do much planning, you can't go everywhere. But I remember for Christmas time, it was the first time from 10 years that we couldn't celebrate. So every year we do celebrate Christmas and New Year's Eve, etc. We were thinking with Yonida, which is here with us today, what we could do something different, but still celebrate on Christmas Day. So we did a gathering in nature. So we found a place far from Tirana, and we did a kind of picnic, keeping the distance and taking, we got our children, not mine because my children are already in the university, but staff, so young kids, and they were playing in the nature, and it was very different from the other celebrations that we have done for Christmas time, but still was beautiful. So we enjoyed that day, and it brought positivity in stuff. As well, the last day, I remember the last day of the year, fortunately we have a big and beautiful balcony. I don't know if Josh, you have been in our offices, don't remember, but we have a big and beautiful balcony here full of flowers, and we do most of our meetings there, which is very nice environment to go away from stress and not to think always office as an office, but it's a kind of even friendship and meeting together. And the last day of the year, just we wanted to celebrate somehow, and we have put in on time schedule. So meaning that we couldn't be all together in the balcony, but we did with small groups. And we discussed that, okay, meeting from different departments, but with small groups. For example, from 10 to 11, this group is meeting to the balcony, and this from 11 to 12, this group is meeting. But it brought positivity, and we enjoyed that. So our mission as leaders is not thinking this only for business, but mainly how to treat people in this how to enter in their world. So, and how, hopefully, how to change their world. And I spend a lot of time meeting everyone and talking about their family problems, because if you don't understand what is in their head, nothing will happen. So you can't expect efficiency and professionalism.
Thank you, Linda. That was inspiring in many ways. Your compassion, the resilience of employees, and I will look forward to joining you on the balcony that you mentioned at some point. So thank you.
Yeah. We welcome you, whatever you have possibility.
Sounds good. So thanks again, Linda. So I'd like to briefly introduce Bledjana. Bledjana, I don't.
Hello, everyone.
Okay, you're there. Okay, I see you now. So Bledjana is the head of human resources at Neptune, Albania. And Bledjana, you're someone who I've seen and verbalize your desire to care for others. And I think most of us have recognized the importance of caring for ourselves during this time and also caring for others. So tell us a little bit about what that looks like for you.
Yeah, thank you for the invitation. We as a leader, we are always trying to give for others. and to give always for others. But sometimes we forget to fill our cup. So mental health is, let's say that it is not easy to talk for him, especially in our culture. The people refuse to talk about their mental health. But mental health influence all our, let's say, human being, psychologically, emotionally, and interaction with others. For sure that mental health will impact us as inside, let's say, our emotions, our thinking, how we think, how we act, and how we interact with each other, how we cope with the stress, how we make decisions, personal decision or business decision, how we are engaged in the problem solving, or the way that we treat each other. It is very important to be focused in caring for ourselves, listening to what our body is telling us, listening or reflecting what we are thinking, because this will impact entire our well-being in our mental health and physical health. There are some red flags that I have seen that the people are not aware regarding their mental health. And I'm talking from experience, from my experience, and from my experience as a professional, more than 10 years working in human resources, that the people do not observe themselves to be aware. Being aware for what is happening in our body and in our mental health is the halfway done, because the people are aware what is happening, and then the next step is to make an action to help themselves. What can be some the red flags that we might keep in our mind and to pay attention? Can be the biological imbalance in ourselves. So it means that eating too much or eating less, the problem with sleep, less energy, unexpected pain to our body, difficult pains in different parts of our body, other things or negative thoughts for yourself, difficulties to stop thinking and rethinking for the past. There are many red flags that everybody of us can reflect to themselves and can mention what is happening in the certain situation. We as a human being, we are not immune to the mental health. We are more, let's say, feel more comfortable to talk for the physical problems that we may face during our life. But talking for mental health makes us to feel stereotyped from our community that we are part of. In the workplace, for us as a human resource, but also for all the leaders, it is very crucial to create a kind of environment that people can talk for their mental health, can come and can ask maybe for not help in the professional content, but can come to the human resources office or to their supervisor to talk regarding the mental health. Let's turn again to what we can do for ourselves to fill our cup, because we are not immune as well. So first, it is being alert what is happening to our body. Second, take a time off for yourself. So take a time to reflect what is happening to you, why you are thinking in that way that you are thinking, and put to yourself the affirmation, or be good to yourself. Consider that nobody is perfect. So every one of us, we are not immune from mistakes. So being good to yourself will be reflected to others. A person that forgive themselves or give themselves a thumbs up will give this to other people as well. Pay attention to the healthy life balance. I mean, biologically and mentally. Rest, take a time to rest. Hello, do you hear me? Hello?
Yes, yep.
Hello? Okay, sorry. Maybe I saw the freezing, but okay, we are okay. Another way that we can face the mental health or difficulties, emotional difficulties, is to find a coach. Nowadays, finding a coach is becoming very, very popular. So finding a coach or a person that can share your difficulties and emotions or asking for help, it would be very helpful. The last but not the least, be aware and be open to ask for the professional help to the psychological one or psychological and the physician that maybe in some cases it will be needed. For sure, the good mental health will impact the productivity in the working environment, for sure helping us to fulfill our potential and to have the good life well-being for mentally and physically.
Thank you, Bledjana. There was so much that was good and valuable there. I found myself asking the questions that you mentioned when you talked about red flags, the importance of a coach, and then paying attention to our bodies. So thank you for all of those helpful points. Speaking of paying attention to our bodies, the last person that I'll introduce is Edita, and I have personally witnessed, Edita, how the change on other people as they're with you for a few minutes coming into Lincoln. It could be a client, it could be an employee being very upset and flustered, and then calm on people's bodies after talking to you for a few minutes. So I'm curious about what secrets from what you do you'll share with us now, but what can you tell us about what you've learned about the importance of good practices for mental health for employees?
Thank you, Josh. It's a real privilege for me to be part of this meeting and share my experience at the Lincoln Center. Well, this year has been quite hard on every one of us, especially at Lincoln. Every individual has been affected. I'm sure that it has changed our emotional, psychological, and social state. And it's not only changed, but we also have learned a few things as well. And I hope that we already have some takeouts from all this situation as well. Being in the educational services, we have changed our business approach in 2 weeks from in-person to online during the quarantine days. And this has made us realize that we have committed employees and excellent professionals who are ready to adapt on every situation. So we are thankful for every individual here at the Lincoln Center who works so passionately and is so committed. Having this current position, I had actually to work at the Lincoln Center for 24 years now. It has made me realize that organizations need to work towards two factors for the well-being of their employees. First, they need actually to work on some safety health policies in order to help them maintain the well-being of their emotional, psychological, and social health. They actually need to be protected. And by having those policies, I mean having medical packages or regular checkups that gives them some incentive to take care of their body and their health. We have this practice every year, actually. We give to our employees every year regular checkouts. So they normally have to go through that checkup. And I'm sure that it's a practice for many organizations as well, but it helps somehow. Also, we are quite flexible, and we are quite aware that people need some time to rest as well. So we are very careful on their medical days or their annual leave. We are quite understandable that we normally give them time for their family and themselves to get some time to rest and take care of themselves as well. organizing training and workshops on mindfulness, it has helped us a lot understand who we are and what we are going towards to as a team, but also it has helped us to maintain our health secure as well. So these policies have changed us toward a better serving to our employees as well. The second thing is to change the culture in our workplace. This pandemic year has been hard, even on the way of our work as well, the way we work and we approach to our clients and to everyone else. So making our employees feeling safe and secure financially, it works. It gives some motivation, and I know that every business actually was staying at home and what was closed during the quarantine weeks. So Lincoln was one of them as well. But most of them normally got paid for every day they spent at home because it was hard to support their families as well. So this was one way to say thank you for their hard work they have done during the years and feel valued as well. Lincoln's mission is to value every individual, their life, and we normally celebrate their life as well. So in order to say thank you for their hard work, we paid them every day, even they didn't come to work in the office. So building a supportive culture of acceptance and feeling them accepted and being them, it's very important as well. We normally share family times with each other, have picnics or have barbecues together so we can share and experience each other as a family. Actually, encourage our employees to spend time on group activities as well has helped a lot. We want to make them work as a team, and being part of a bigger team, a bigger family, it helps to our business actually to be more productive and reach our goals and objectives of the year. So it helps us a lot working as a team. So valuing each individual, giving security to them, help them feel accepted by everyone, supporting and showing compassion sometimes, because most of the families normally of the individuals have lost a family member or have gone through some traumatic situations during the year. This all actually are the foundation of a healthy workplace and environment. These are some issues that I've learned during this pandemic year and considering in report to my experience at Lincoln.
Thank you, Edita, for sharing some of what you've learned over the past year with all of us. So great. What we're going to do now is we're going to give all of you the chance to share some of your thoughts on these questions in breakout rooms. So each of you will be with either Edita, Jim, Linda and Yonida, or Bledjana. And then we'll come back together for a few minutes to wrap it up. And so you can go ahead and click to join your breakout room.
Hello.
Okay, I think somebody needs to be muted. And then, yes, Bledjana, you mentioned Linda was sharing something. So
Ermelinda
go ahead.
Nezai
Yes.
was mentioning something very interesting regarding the two-way communication between body and mind, how they impact each other. So if it's okay with you, we can continue just to finish and can be the representative of our group as well.
Hi, everybody. I just wanted to just conclude this. I was talking to my group, and everything that we create is a two communication ways between our brain and our body. So we are aware that our brain controls our body, but we don't always realize that our body is communicating back with our brain as well. And being stressed can negatively affect our body, and we must understand that our brain and body are constantly in two-way communication. And what I gave as an example, and I remember this sadly, a coworker of mine, he was always complaining about high blood pressure and not feeling well, and he did all sorts of exams, and the doctor said to him that he was perfectly fine, but what was causing this was too much stress. And I know it is very difficult. It's not just in Albania, it's a stigma everywhere when we talk about mental health, and we somehow refuse to get professional help. Even though I spoke to this gentleman many times, and I said, listen, you have to take some precautions about your mental health, and I'm here to help you reduce the stress that you're going through. But it was too much for us to ask him, and it came to a point that he had a heart attack and he had to go to the hospital and had surgery. And this was one of a big wake up for me, that I actually didn't just have to take care of the employees and my coworkers, but it was a wake up call for me as well to take care of myself. So that's why I'm now working daily. I have my routine that I want to take all the stress out of my body and detox my system, so I can allow myself to relax and be energized every day.
Thank you, Linda, for sharing about that detox routine that you have. Great idea for all of us. From Jim's group, Ida, would you like to share something if you're there with us? Or Irida? Okay, I'm not sure if there's anyone from Jim's group that would like to briefly summarize something from the group. If not, we can move on to another group.
The only thing I would say, Josh, that I would defer, to a member of our group as well, that I think there was, in the time that we discussed the challenge and the concern that we all had for our employees during this time, and wanted to do as much as we could. There was some various strategies that people shared, or we began to, as I think, introducing each other. But overwhelming sense that I got from everybody was just the care and concern for their staff and the various ways. So I think that's been a huge benefit of today, but I'd look to maybe some others to elaborate on that. Yeah.
That's great, Jim. Thank you for representing what was impactful in the group. And Bledjana, is there anything that you would like to share from your group that you think was valuable? Or actually, I think it was Linda that shared from your group.
Linda, Melinda.
Yonida, anything you'd like to summarize from your group for us?
Yeah, it was the time was really short. We didn't have the time to actually discuss, but I'll summarize what we could understand from our sharing the experiences is that the care for the staff was the main priority for the past year. Telling to them, assuring them that they will be financially secured somehow during the difficult times, their workplace will be secure no matter what, and the adoption of the work activities to the new normality would be like a priority. So business must go on at the end of the day. So adapting all the activities from offline to online is what actually is being done now. So these are like the main issues we could get from this very brief discussion.
Excellent, and thank you for doing all that with the brief time that we gave you. Edita, what would you like to share from your group?
Yes, it was a short time actually. We should leave a couple more minutes on their own discussion. But it was a pleasure to talk to Edita and Nikolla, and they both shared their experiences with their organizations towards the approach to their employees during the pandemic times. It was very interesting that OTP Bank and Edita shared that they're currently having a virtual meeting with having an interview meeting with specialists, infectionists, with their employees. So they're informing their employees constantly on how to behave during this COVID time, which is excellent because none of us has enough information, and we should actually take example out of it. So thank you, Edita, for sharing
Thank
that.
you. Great example from OTP Bank. So we are wrapping this up. Thank you to all of you for attending. A few of you mentioned specific areas within mental health today that are often taboo. The next month in this series, we'll be looking specifically at burnout, anxiety, and depression, how those impact employees, and strategies and practices that we can have for supporting people with those challenges. So we look forward to your feedback on today's session. Again, thank you for attending. We hope in the future that there's more time for discussion in the breakout rooms. So have a great rest of the day, and thanks again for being a part of this.